My name's Cody Manriquez, and this is my parasite presentation for Microbiology 480, Parasitology. So I'm centrally located in Bend, Oregon, and it is a high desert area with a temperate coniferous forest. It's very mountainous around here. So I interviewed Cindy Elston. She is a doctor of veterinary medicine and an MPH. She works at Central Oregon Community College in Bend, Oregon. She has 20 years experience in veterinary medicine. 10 years in general practice in Seattle for her first 10 years of general practice. And the past 10 years she's been working both in general practice and teaching here in Central Oregon and other areas in Oregon. Since Dr. Elston has worked mainly in the Pacific Northwest, she talked about her overall experience. And what she found was Toxocara canis, a roundworm, is very cosmopolitan in all animals, especially canids or dogs. The other most prevalent parasites in this region are ticks and fleas. With Central Oregon, fleas are not as prevalent due to its really dry summers, but very wet winters. So out of these three, the most prevalent is Toxocara canis. It's a nematode. It's a roundworm, mainly in dogs, like I said before. As you can see on the left, there's a picture of a common Toxocara. It's very common in puppies and resides in the GI tract and lays numerous eggs. It does have a paratenic host, which is rodents and are often passed this way. It's also zoonotic and can cause some severe and mild disease in humans. There's about a 40% chance that dogs are infected with this parasite, and nearly 100% of puppies, which is pretty staggering. And the prevalence is due to its easy transmission through the environment. With humans, roughly 14% actually carry antibodies for this parasite, according to Elston. And in developing countries, 50 to 80% of children are infected. Here you can see the life cycle of Toxocara canis. The eggs are excreted in feces, and they're picked up by the paratenic host or the definitive host. The J3 juveniles are the infectious stage. When they enter a juvenile host, they actually will go through tracheal migration, where if they enter an adult host, they often will migrate from the intestinal tract or the GI tract and encyst into muscles. They can also be passed from the parent in transplacental transmission or through mammary glands. Control of these parasites are fairly easy. Either picking up after your dog, especially in yards or when you take them for walks, deworming your pets, especially puppies, and rodent control. In humans, washing your hands after working in the yard or playing in the dirt, keeping the young out of areas where animals defecate, and keeping objects out of these children's hands and educating them. I found that people with pica are often at high risk for this disease, which is not surprising considering that the eggs are often passed in animals' feces. So what happens when this parasite becomes zoonotic and enters the human host? Well, most notably, the most common disease is toxocariasis. This is usually mild, with mild symptoms though. More severe symptoms can occur in ocular larval migrans or visceral larval migrans. Ocular larval migrans is when there's migration of the larvae and they make it their ways to the eyes. With visceral larval migrans, they can migrate to any part of the human body. Many of the problems associated with these diseases are its damage to so many human organs and other parts of the body. It also causes severe inflammation in the liver, lungs if migration ends up in there, and blindness in ocular larval migrans. Diagnosis for this parasite is fairly simple. In dogs, fecal examinations are common, and checking for symptoms. If your dog is coughing or wheezing, this may be a sign, but it also may be a sign of other diseases such as heartworm. In humans, you can test the blood for antigens of this parasite, but it can be often difficult to identify. And you can look for signs and symptoms of visceral larval migrans or optical larval migrans. And also if the patient has a dog which is also infected, this may be a telltale sign and you want to do more tests to check for this parasite. In treatment of this parasite, worming is often used in juveniles and is an easy way to treat juveniles. Anthelminthics are often effective in dogs. In humans, albendazole or mebendazole are often used to treat visceral larval migrans, but it's a lot more difficult to treat ocular larval migrans. And the best way to treat these is usually just preventing further damage, and you can never truly get rid of ocular larval migrans. I was curious if this parasite caused any pain, and according to Dr. Elston, the insisted stage doesn't really cause any discomfort. Migration may cause some irritation, and toxocariasis may cause inflammation and other signs and symptoms that may be quite unpleasant, but that's usually more with severe disease. In dogs, there's really no pain in the GI tract where most parasites reside, and the most painful thing that they go through is often coughing spells, which may be more discomfort than actual painful. So the high prevalence of this parasite isn't only due to its easy transmission rates, but it's also due to the domestication of dogs and the high density of dogs that we have within our population, especially here in Central Oregon where I live. Bend, Oregon is a very dog-friendly city, which only contributes more to the problem. So I had asked Dr. Elston in my interview if she had had any abnormal or strange parasites that she'd encountered in veterinary medicine or any memorable experiences, and she had a memorable experience. This one also was with Toxocara canis, and she had a client who bring their dog in and was testing it for worms. Well, the test came back negative, but with Toxocara canis, a negative test does not mean that the animal's negative because their eggs are excreted periodically. So she still treated the dog for worms and sent it home. Within hours, she got a phone call because the dog was vomiting up large piles of live worms. And the lady was frantic, and she'll never forget this. And it was just a reminder to her to educate people about these worms a little bit better, and the fact that you may not see them, but they may still be there. And they also can come out the mouth when you're not expecting it. In summary, Toxocara canis is a cosmopolitan parasite, and it's all over throughout the world. Its definitive host is a dog, but it can infect humans and is zoonotic. It does have a high prevalence due to transplacental transmission as well as dog-friendly regions and its easy transmission in feces. Controls are easily managed by education and other fairly simple methods. And it's fairly easy to treat with the exception of ocular larval migrans. So this is the end of my presentation, and I appreciate you taking the time to listen to it. Thank you.